Cupping has very ancient origins. In fact, a very similar technique appears in the Ebers Papyrus, a medical text from 1500 BC, but it is considered a therapeutic approach typical of traditional Chinese medicine, also present in numerous other cultures such as Indian, Korean and Japanese. In the West it was spread by the Austrian Dr. Bernhard Aschner in the early 1900s as he used the humoral therapies of Hippocrates, Galen and Paracelsus. Today cupping consists of the application of glass, plastic or silicone cups of various shapes and sizes to the skin, with the aid of a manual or electric pump to create an air vacuum inside it and a negative pressure around the skin sucked inside it. Precisely this negative pressure stimulates blood and lymphatic circulation, improving circulation, helping the body to get rid of toxins, reduce inflammation and tissue pain. The cups can be positioned on various parts of the body, for example along the spine in the case of back pain, on fat deposits as in the case of cellulite, on muscle or joint pain points after a sprain. Cupping can also be used on acupuncture points to achieve a similar effect to that of needles, but in a less invasive and uncomfortable way, or in combination with other techniques such as physical therapy to improve blood and lymphatic circulation. At the beginning of the application, the patient may experience an uncomfortable sensation of pressure on the skin, but this generally disappears after a few seconds. The duration of the application can generally vary from 5 to 20 minutes and can be repeated 3 or 4 times in a week. Cupping can be used for the treatment of many pathologies such as musculoskeletal pain, dermatological diseases, respiratory system, digestive system, or nervous system, but also to improve stress, anxiety and insomnia. The signs that remain on the skin at the end of the treatment, such as the appearance of more or less evident bruises, are not the result of a painful procedure but the signs of a detoxification process that has begun and which manages to mobilize not only the body's fluids but also the energy circulating in it, the so-called qi of Chinese medicine. In this way the toxins present in the deepest tissues of the body, as well as dead cells, pathogens, lymph and many waste products, rise to the surface of the skin of the organism. The removal of this material occurs thanks to the vacuum effect, i.e. the effect of creating a vacuum inside the cup, as it induces cellular and blood turnover which brings greater oxygen and nutrients to the cells of the body, increasing their vitality and general state of well-being. There are no particular contraindications in using this technique, but it is not recommended in cases of pregnancy, wounds or skin infections, blood clotting disorders or heart failure. Cupping can be done independently, but it is always better to rely on the expert hands of a doctor or physiotherapist. In conclusion, it is a 1,000-year-old technique which, like few others, still manages to easily bring countless benefits to the body today, which is why we recommend it.